In this segment, I'm going to demonstrate a muscle energy technique for a posterior innominate rotation. So the pelvis has rotated posteriorly on the sacrum and has restricted motion anteriorly. So if this is rotated posteriorly, what we need to do is move it anteriorly. So the technique as such is to use a short lever anchor on the PSIS. So this is his right PSIS because he has a right posterior innominate. I'm going to stand opposite that so that I can put pressure up and out laterally. I'm going to reach down here and get under his tibial tuberosity of his lower extremity. So when I lift him up, his knee doesn't bend. And I'm going to just sort of move him abduction and adduction just to get an idea if I have motion up to that point of that joint where it's relaxing in a kind of patient passive mode, and just feel the movement, the intersegmental movement up and down, so I capture it. And now I ask this patient to please push with a moderate force your leg down to the table, towards the table. He's using the hip flexors, iliopsoas, etc., iliacus, pulling the pelvis forward as I use a short lever in the posterior aspect and relax. And you can do this 3 to 5 seconds if you want to hold it for a little longer. This is a move the bone technique, so I'm actually using the muscles to pull the pelvis or the innominate in an anteriorly rotated manner. So he can actually push a little harder with this technique. Push again. And relax. I can lift his leg up just a little bit, move it to get the better vectoring, and now again push it down to the table. And relax. And you would repeat this 3 to 5 times. And then you would place the patient back, and then you would do your intersegmental motion testing, your pone motion testing, your standing flexion test if you wish, to determine whether you've improved that dysfunction or not.